So EMDR stands for eye movement, desensitization, and reprocessing. And what it is, it's a specific form of therapy that allows us to get into the limbic system of the brain where traumas are stored. So we're able to access it there, desensitize it, and then move it to a different part of the brain where the brain can now realize, okay, that happened in the past. It's no longer an active threat. So it's really, really powerful.
Ginger Poag has 30 years of experience in mental health as a licensed clinical psychotherapist and trauma counselor. She is a distinguished expert in EMDR therapy, one of a few thousand worldwide holding certification and serving as an EMDRIA approved consultant. As the founder and executive director of the Columbia Center for EMDR Therapy, she is committed to advancing trauma treatment. Her specialization includes working with adult survivors of childhood sexual abuse, individuals with PTSD, victims of narcissistic abuse, and those experiencing anxiety disorders of various severities. In addition to her private practices, she has provided trauma therapy and counseling at several prestigious treatment facilities across the U.S. Ginger's academic contributions include published works that have been incorporated into social work curricula at universities both in the U.S. and internationally. Her professional experience also extends to supporting survivors of mass shootings and terrorist attacks on both domestic and global scales. And on a personal level, Ginger was my personal therapist and EMDR counselor. Welcome back to Take Back Your Health with Dr. Amy Myers. Today's guest is Ginger Poag, who is I actually am going to call you a friend, Ginger, because I do consider you a friend. Ginger is a friend, but she has also been my therapist and helped me significantly going through a situation with PTSD and using EMDR, which is what we're going to talk about today. So welcome, Ginger. So happy to have you here.
Thank you so much. It's wonderful to be here.
Ginger, has significant training in trauma. You're a clinical social worker, a clinical therapist. Can you kind of give us your background and how you got interested in that?
Sure. I've always known that I wanted to be a therapist. I got into the field when I was 18 years old, and I worked with a lot of different populations. I worked with seriously mentally ill, abused women, substance abuse treatment centers. But I really found my passion and calling for post-traumatic stress disorder, any kind of trauma that individuals have gone through. And through my work, I found that EMDR was the most amazing and effective form of therapy for treating trauma. And I dedicated my whole life to it. So that's my main focus.
Well, I can certainly personally attest that you were extremely helpful to me, and I will talk about this as we dive a little deeper.
Sure.
I had done some EMDR many, many years ago after the death of my mother and surrounding just some sort of childhood divorce, type things, and didn't really find it helpful, but this time with you really did. So I'll put a pin in that. But before we start, can you tell us what exactly, for those that are not familiar, like what does the acronym EMDR stand for and what exactly is it?
Yes. So EMDR stands for eye movement, desensitization, and reprocessing. And what it is, it's a specific form of therapy that allows us to get into the limbic system of the brain where traumas are stored. So we're able to access it there, desensitize it, and then move it to a different part of the brain where the brain can now realize, okay, that happened in the past. It's no longer an active threat. So it's really, really powerful.
So tell me, when somebody has a trauma, and this, I think we will probably agree when we're talking about trauma here, this could be a physical trauma, a physical trauma. It could be an emotional trauma.
Yes.
It could be even, there's a lot of research coming out now, even just things that we perceive, as being, or even our own thoughts can be traumatic. You and I discussed this, that I didn't personally have some of the traumas that we've worked through, but friends went through the trauma, and I just am a very, empathetic person that I was kind of taking on their traumas, or I would think about their situation and it was causing trauma-like symptoms within me. So tell us, when you say trauma, is this what you're referring to? And then what do you mean it's getting stored in the limbic system of our brain?
Sure. So when I'm talking about trauma, I'm talking about anything distressing that may have happened. So one person could go into a situation and it could just be a comment in passing that somebody said, but for some reason that is stuck with that person, kind of like it was the perfect storm. There are all kinds of other factors going on at the same time in the person's life, and that comment ended up sticking with them and affecting them long term. It's also like the traditional traumas of being in a car accident or being in a mass shooting. It's really there's a big variation in what we can treat with the EMDR. When I say it gets stuck in the limbic system, that's the emotional part of the brain. So when something happens, it's almost as though the brain takes a snapshot and freezes it in that part of the brain, the emotional part of the brain. And that part of the brain can't tell time. So it doesn't realize that, okay, this event has already happened. It's in the past. So on a subconscious level, what we do today is being affected by that trauma that's still stored and unprocessed. And it can be stored and unprocessed for a couple of different reasons. It could have just been too much emotionally on the person. The brain might not be able to process through it because there's so many other things coming at the person. The person may have forgotten. They may have gone into a dissociative state where they don't remember that it happened, and it stays there. But as it stays there, it's affecting the person day to day, and it shows up. Maybe it's anxiety, stress, substance abuse. It can show up in a lot of different ways.
And so do most people that are coming to you, I came with a very specific trauma and was referred to you because of your specialty, in PTSD and trauma. But when most people are coming to you, are they able to identify, a situation or a trauma, or are most people coming to you with the symptoms such as anxiety or sleeplessness, or maybe even, now we know there's a large correlation between, an ACE score, which I've interviewed a number of people about, and trauma and autoimmunity and chronic illnesses. So are most people coming in saying, I had this happen to me, and which is kind of what I did, I had this happen to me, and, this is specifically what I want to work on? Or are most people coming or getting referred because they have anxiety, they have sleeplessness, they have a chronic illness, and then you are able to tap in and uncover, what the actual underlying trauma is?
So I actually see both. The majority, I would say, are people that are able to identify what the traumatic event was or what the distressing event is. And they're at a point where they're ready to go ahead and start working on it, or possibly their talk therapist may have suggested that they get EMDR for a specific traumatic event that happened to them. Other times, and it's a smaller amount of people, will come with just the symptom: sleepless nights, anxiety, stress. They're not able to regulate their emotions. It could be a lot of different things. And then we work from those symptoms back. So we kind of back engineer where the root cause could have been for these symptoms.
And so can you tell us, when did EMDR come about? And is there sort of like a grandfather or a grandmother of EMDR? And, can you tell us about the evolution of how this type of therapy came about?
Sure. So in the 80s, Francine Shapiro was working on bilateral movements and studying it. She went on a walk in a park and she was thinking about some distressing events. And she noticed that as she was using these bilateral movements with her eyes, kind of shifting them from left to right, right to left, back and forth, that the stress that she was feeling was actually decreasing. So she took note of this and got together with some other researcher friends and psychologists, and they started working with each other and saying, well, I wonder if we can do this. What about if you think about this and then we move your eyes? How does that feel? So they were able to come up with a protocol that we still use today. And they started working with vets on it, and they found that this was just a miracle. It was huge. It was amazing on the amount of distress that they were able to decrease on these vets. So it's just kind of progressed from there. Initially, when it was formed, we just used eye movements for the bilateral piece. Today now, we also use these hand tappers that gently buzz from side to side. And there's also audio that we can use where it might beep on this ear and then this ear, and it goes back and forth. So we're actually progressing more from just the eye movements.
And so, I mean, I imagine there was research done on this showing,
Yes.
but I mean, what is the mechanism,
Yes.
of how this is reorganizing the brain or
Right.
rewiring the brain? What exactly is happening? And
sure. So there's a couple of different theories. They don't know specifically, they can't pinpoint it, but they have a couple of different ideas. One is that we're able to replicate what happens naturally when we're in a REM state of sleep at night. So if you look at somebody who's in a deep state of sleep and you peer over them, you'll see that their eyes are moving back and forth, back and forth. And what's going on is that the brain's sorting through the day's events. It's storing what it needs. It's getting rid of what it doesn't need. It's processing through events. So there is a theory believing that, okay, we're just targeting that power of the brain on specific incidents that have happened, and we're able to process through that. There's another theory that what we're doing is taxing the working memory, where it's the distraction of doing the movements that's actually helping to get it processed. So there's a couple of different theories. But what we do know for sure is that we are able to access it in the limbic system, process through with bilateral movements, whether it's the eye movements or hand tappers or the sound. And then the emotions are all desensitized. And then it gets moved to a different part of the brain, like the prefrontal cortex, where now it can look at it with reason and rationality instead of fear-based, or in that part of the limbic system that is all emotion-driven.
And so, well, let's walk through. You've kind of mentioned these three different modalities. You and I did it on the computer, and often I would do the eye movement with the sound. So I followed my eyes and heard a ding, ding. But I, as you know, also own the handheld vibrating ones that you would have me do some things at home. But do you want to just, for our listeners that haven't ever experienced this before, and I imagine many things are remote these days because of COVID, but is it different if you're in the office one-on-one with somebody than if you're remote?
Sure. I always think that it's always best to be in person if you can. However, we're getting great results online. And they're actually finding out that it might be even a little bit more effective online because the individual's in their own environment at their house where they feel safe. They don't have to travel. They don't have to drive through rush hour traffic to get here. So we're actually seeing that it may be a little bit more effective there. I enjoy in person because I'm able to connect more with the individual. But I would say my practice is about 50-50, half online and half in person. I also do EMDR intensives, which are 3 to 6 hours in length. And I prefer those all to be in person because that's just a lot of time to be on the screen. And as we're processing through a lot of emotional heavy stuff, it's just better to be done in person.
Yeah. So for the listeners here, I think if you haven't heard my story, you can go back and listen to the podcast with myself and Dr. Ann Shippey, where I think many of you all know I built a very sophisticated home in Santa Fe, New Mexico, to never be exposed to toxic mold again. And 6 months in, they had not followed the plans. My builder, Palo Santo Designs, and we had mold in my home. And I'm almost getting choked up just retelling this part of the story. Ginger knows it well. That I wasn't in the house very long because we had traveled, and I immediately came home and felt the mold. What happened to me was you diagnosed me with PTSD between you and my physician, Dr. David Hasse, who I'll have on here soon as well, because I had spent 4 years thinking that I was building this very safe home. And then the builder simply didn't follow the plans that the engineer had drawn. So, I went into a complete spiral, as you know, and was unable to work. I was frankly unable to function, which as a highly functioning person who's traveled the world by herself, it was really, really distressing. And you know that that a lot of times I would get triggered when I was in a small space, such as an airplane. The minute they would close the airplane door, I would get triggered. Maybe you can speak to it more. I'm guessing it's because, when you don't have shelter that you feel safe in, and then suddenly you're in this enclosed space, and maybe I don't feel safe. It just, triggered all of these emotions. For the people that don't know the full story, I at one point flew home to Austin to see some of my doctors, had my first appointment with you, Ginger, and ended up, you were trying to help, which we'll get into there, I guess, a positive, trying to both get the negative emotion out of me, but also then trying to set me up for a positive experience of getting on the airplane and being successful at flying without having a panic attack. And this is meanwhile, having Xanax in my pocket, and generally, I can now fly without taking Xanax, which is amazing. But I was not able to then, and to have a successful flight back. Anyway, I wasn't able to do that. And I had to fly Javier and Elle down, and they flew back with me. So that's, how bad it got. And so you were so helpful with desensitizing me to this that I ended up flying you to Santa Fe. And we spent 2 days going through every room in the house and desensitizing me to every room in the house. And I still have, a flicker here and there, but for the most part, am successfully living in my home,
wonderful,
not in fear, and not with PTSD. So thank you very much.
You're so welcome. You're so welcome. Yeah. You're a pleasure to work with. So,
well, thank you. Yeah. So let's talk about, this for me was a very successful, foray into EMDR. And I was a little bit hesitant when it was recommended because, like I said, I had done it previously. Now, when I did it previously, it was in person. And, I think I was dealing with a lot of very, very old. I mean, there's nothing traumatic from my childhood other than, it's a normal childhood stuff, right? My parents got divorced. My dad lived that's maybe not normal that my father lived 700 miles away from me and I only saw him a few times a year. But, I didn't have anything, specifically traumatic other than the normal, childhood stuff. But I didn't find EMDR helpful then. And so, one of the things that kind of came to me, and I'd love to hear your thoughts about this, was that, with the recent trauma of the house and the mold, it was so fresh and it was very traumatic. I mean, it took nothing to get me to tap into, one of the things, and you can describe it better than me, is, you have the patient get into that state or to think the thought of the traumatic event. And it took nothing for me to, get very triggered. Whereas, maybe some of this stuff, because it was much older from childhood, and I don't even know if I really remembered some of it. It might have been stories that other people told me, right? That it was maybe harder to get triggered. I don't know. I'm just kind of curious. Yeah. Do you see that a difference between sort of something that's more acute versus something that's, older and chronic?
Yeah. So it really depends.
Success.
Yeah. So it really depends on the client. It is much easier to access the more recent traumas, and especially with what you were going through. It was so recent. It was in a moment. We were actually continuing to go through it for an extended period of time. So that it was much more easier for us to access in the brain. As far as the early childhood stuff, it really just depends, because we can have two people go through traumatic events and one person may be okay. It hasn't stuck with them. It isn't interfering with their day-to-day living now, where the other person, it could be very fresh still, even though it happened 20 or 30 years ago. So it really just depends on the person. But generally speaking, the more recent the traumatic event is, the easier it is for us to tap into that. Yeah.
And so, I'm sure you're familiar with the work of Peter Levine. And so, reading some of his work, just kind of the differences, because I've probably, anyway, I like to experiment with all kinds of stuff. And one of the things that I was reading with that is that, people who are going through talk therapy, it can be almost more triggering or as triggering because they're talking about the event. And then, as you said, that all of this is stored in your limbic brain, which is not a critical thinking brain, right?
Mm-hmm.
It's a reactionary brain. And so then you're telling a story and you're trying to get your critical brain to think through it and solve it. But it's really almost more triggering. I mean, I feel like you and I would talk about this all the time. Like, I feel like I'm a smart person. And if the minute they would close the airplane door, I mean, all rationale got lost on me. It's like if this was a problem that could be solved rationally, I'm quite sure I could have solved it, right? I mean, that's the whole point, that it's beyond ration and rationale. I mean, isn't that the whole point with trauma, that people have these reactions that are not rational?
They're an overreaction to something. Yes.
Right. An overreaction to something that should just be normal. They're closing the plane door like they do now. They're closing the plane door. Yay, I get to go on a trip. But instead it was this, sort of panic feeling. But anyway, can you speak to, because I think did you do talk therapy before you moved into EMDR? And so can you kind of compare those those types of therapies for us, and success and your thoughts on re-triggering traumatic events?
Definitely. Yes. So I started as a cognitive behavioral therapist, had success, but oftentimes felt when I was working with specific clients, I could only take them so far, that there isn't a way to think yourself out of certain traumas, because as you were saying, you're very intelligent, you're a rational person, but there's that overreaction of there's a stimuli and there's the overreaction. And that you can't think your way out of that. It has to be targeted with EMDR therapy, something that's going to go right into that limbic system of the brain and help to reprocess it. So I did that for many years. And then I actually didn't believe in EMDR when I first heard about it. I thought it was the biggest, I just thought it was the power of suggestion that was working. So I went and I studied it. And as part of studying it, they encourage us to get our own EMDR therapy. And that's when I realized that this is the real deal. This is going to change people's lives. And from that moment on, I've dedicated my whole entire life to EMDR, helping people. I'm a consultant, a trainer. I own a group practice just specific to EMDR because it's so effective. And what you're talking about as far as sometimes it being more triggering, like talk therapy, yes, I definitely see that, where I feel like there's a form of narrative therapy where you keep telling your story over and over and over again. And it can be more traumatizing to the client. Especially I see when we're working with sexual abuse. There's sexual abuse or a sexual assault. With traditional therapy, you're telling the therapist every detail of what happened. And especially if you're doing that narrative form therapy, what I like about EMDR so much is that all of the work's happening in your brain. So as long as I know a little bit of the story, I don't need all those details, and you can still heal from it. So the individual will just need to tell me just enough, like it could be a parking lot. That's all the information I need. And then I gather, a negative belief, like I'm powerless. And then we start processing from there, which is so much better than telling me every single detail. And the client's always welcome to do that. But sometimes they don't want to talk about every single detail when it was something very horrific for them. So that's why I'm just so thrilled with EMDR.
And it can be. So, I mean, for me, it was, all of this happened in a laundry room and in the hallway. And I could just think of the laundry room and not even necessarily all of the events and everything that happened after that. I mean, I imagine if someone's had a traumatic experience, such as a sexual assault in a parking lot, just thinking of a parking lot is all they need to, conjure up that trauma. Now, do you ever need any special assistance or anybody on standby when you are working with people because you are, pulling up these traumas?
No, I've been doing it for so long that I'm able to assess pretty well if, where the client's at. And if we do get to a point of like let's say, complete dysregulation, I stay and I work with a client to get them back to a space where they're okay to leave the office or where they're okay to continue on with their day. Because there are times when things are just so intense, especially sometimes repressed memories will come up. And it really shakes the client's foundation. So I will just stay and work with them. I might have to cancel my next client, but if they're really upset and it's just so shocking to the system, we work on getting them grounded in a good place. But usually before that, what I do is I do preparation with the client, teaching them grounding exercises, how to control, certain emotions, how to breathe, different things, so that they're going into the EMDR sessions with tools and they're already prepared on how to, bring themselves down or how to not get into a dissociative state or not to go too far. Because we really want to keep that window of tolerance with the client in mind, because if they become too dysregulated or just too intense, we can't do any processing. So they have to kind of be in a sweet spot where, they're feeling activated, but it's not overwhelming to the system.
And now, I'm assuming this is always an individual therapy, or is there ever a place that this could be, for couples, or if there was a traumatic event that involved another person that they could be there?
Yes. So traditionally it's just individual. However, I've had this recent situation where a couple lost their son tragically. They were both there. So what I was able to do, and what I'm still doing because I'm still actively working with them, is I have the husband and the wife there together. They're both using their own hand tappers, but we're using something called a recent traumatic events protocol, where they're telling me all the details of the story, what they feel comfortable telling me. And then we go back and we process through, we call them points of disturbance, certain parts of the memory that are really distressing. And it's been so powerful because they're able to share with one another. They went through it together, they saw it together, but now they're reprocessing through the trauma together. And it's been the most beautiful thing that I've ever seen, because they're getting that support from one another. It's really taken their marriage to a whole different level. So,
and I imagine they could each have different, traumatic points or whatever you refer to it as, Okay. And what about, you and I had chatted recently about other things to actually also help assist in, accessing these events for people who are, more shut down. So are there things, such as ketamine or any other agents that people are using to help people access or to help, improve or heighten their EMDR experience?
Yes, definitely. So I will use ketamine with clients that I either feel possibly we're getting stuck or they're really shut down and they can't access it, access those emotions or those memories, and they know it's there. It's usually based on, what we've done with the client before I go to that step. Like, how long have I been working with a client? How much work have we gotten done? And if I feel that we're at a point where we've maximized what we can doing EMDR the traditional way, then I'll have a conversation about, okay, well, how about introducing ketamine into this to see if, we're able to access more, things are being able to open up more. And it's been so effective, and we're being able to process through so much at an even quicker rate with the ketamine.
And so someone would need another doctor on board for that to prescribe the ketamine. And
yeah, so I work with Dr. Hasse. He has a ketamine component of his practice. So they can either we'll go there and receive the ketamine treatment, and then I'll work with them right after it, because it's still in the system and they're still really
IV
open.
ketamine, right?
Yes,
at that point.
IV ketamine at that point.
Yeah.
And then there's also where we do a very low dose form of ketamine with lozenges, or what they call them troches. And that's separate from Dr. Hasse's, but I work with another practitioner, prescribing physician, who monitors that. And we're able to do that in my own office there with a client.
And so short of that, do you find that clients need any other type of therapist, or really this EMDR kind of, if they're dealing with a traumatic event or PTSD, really you can just solely stick with EMDR?
Yeah, they can solely stick with EMDR. However, if they like to talk a lot and they like to verbally process, I will have some clients that will have a talk therapist in addition to me, and we'll work great together, the other therapists and I, and they're able to come and like be really focused with me and like, let's get through this, and then go and explore more with the talk therapist. So,
okay. Yeah. And I imagine every, client is different based on, their individual traumas, how recent it was. But is there, I guess, a timeline at which, do you see benefits? Do most people see benefits after one session, two sessions? And then, I highly doubt people are only dealing with one traumatic event. But,
right.
is there sort of a process? Is there an end to this? Or is it sort of, once you're in, you're kind of in EMDR forever?
Sure. So it depends again on what they're working with. If it's a recent traumatic event, like the couple I just talked about, or if there was an accident or a shooting, it's only a few sessions. It could be like, let's say 690-minute sessions, because it's a specific event that has a beginning and end, and it's usually recent. So it hasn't had a chance to go into that long-term memory yet. So we're able to access it, desensitize it very quickly, and reprocess it. So if you can get to an EMDR therapist within 3 months of an event happening, you can process through it much quicker. So yeah, that's what.
Yeah, I think what you told me, mine was longer because I was eventually moved back into my house. And as you were telling, poor Ginger had to like go through depositions and all kinds of things because of my lawsuit, which we prevailed, that, and they were questioning my diagnosis, saying I had never been to war. And, you and I both responded, well, it was worse in a certain way because at least war ended and then somebody comes home to their home.
Exactly.
I was living in my war
Living
zone.
in the war zone.
And walking past the laundry room and having to go in the laundry room, on a daily basis. So, I feel like we definitely had an endpoint. I mean, I probably can always have a tune-up, but
sure. Yes.
Just adding yours that component.
Yours was a little bit longer because you were still in the trauma. There wasn't an end yet to it. So we were able to work on a lot, get a lot processed. However, with the court situation being dragged out, you were still in it. So then, that's why it took your situation a little bit longer. But there definitely is an end point. Sometimes it's 3 to 6 months. But what usually happens is that the person gets such amazing results with the EMDR is that they want to start working on other things.
Well,
too.
that's also happened with me.
Yeah. They see how effective it is. So we start with this traumatic event, but then, I want to maximize myself in this area because we can also do positive things, not just the negative traumatic events. We can do, we call it future template. How do you want to see yourself respond in a future situation? So there's a lot we can do with the EMDR.
Yeah, well, let's talk a little bit more about that because we did that not so much future, but just when I knew that I was going into situations like travel on the airplane or going into my deposition or, when I was, because they were personally attacking me, you and I did some of that work to try to, ease my anxiety in those situations. So how does the futuristic
future template. So what we do is we identify the situation where you'd like to have a different behavior or you'd like to see a certain outcome. We worked on what are the negative emotions associated with it. So it's anxiety, the anticipation that somebody might say something to you, or with the airplane, that you're going to have a panic attack on the airplane. So we will try and desensitize some of that first, and then go into, okay, I'd like you to envision yourself, how you want to respond in that situation. And then I'll have you envision it and picture it, almost as though you're playing a movie in your mind. And I'll have you do that several times as we're using the hand tappers or a form of bilateral stimulation. And then I'll ask, are there any roadblocks? What was getting in the way of you being able to complete that picture in your mind? And if there were roadblocks, we'll go ahead and process through those, desensitize those roadblocks, and then we'll go again. Okay, I'd like you to picture yourself having a different reaction in the situation. And as you're able to get to that point, we'll add a positive belief. And it might be, I can overcome anything, or I'm powerful, or I have choices. So we'll stick that positive belief in that memory, or in that movie that you're doing on how you want to have a new response. I have choices, I have power, and we play it out. So what we're doing is we're actually creating a new neural pathway where that event is more likely to happen. So you're more likely to have that response that you want after we've done this exercise.
Mm-hmm. And so do you have people that, come to you just for that part? I mean, has the word gotten out about EMDR that you can just come for the positive aspects of it?
Yes. Especially a lot of musicians, a lot of people who perform stage fright. Sometimes people that be doing freight for 20 years, no stage fright, and then all of a sudden something happens, and they're afraid to get back out there on stage. So we definitely work on that a lot. However, we do have to do a little bit of the distressing or the negative, because that anxiety component, let's say it's the fear of being on stage, we will process through that little bit of that negative component, the anxiety, before we get to the positives. But it doesn't take us very long to process through that. It's much different than if you were to come to me with a traumatic event and we're processing through all of that. Mm-hmm. So yes, the word has gotten out.
The word has gotten out. Okay. With neuroplasticity and, EMDR. And how, young can someone start doing this?
Yeah. So we can work with really, really young kids. We can work with, toddlers. We can work with like 3 to 4-year-olds. It's very, very effective. Yeah.
And I know I guess it was, were you at my house when that happened? Elle and a friend locked themselves in the bathroom.
Yeah, I worked with her. She's fantastic. Yes.
Oh my God. Yeah. Just for the listeners, Elle and a friend were playing, and they went into, it's now my podcast room. There's a bathroom right here with this sliding door, but it was the guest room at the time. And we hadn't seen them in a while, and we were listening to some music, and like one of Elle's favorite songs came on, and I was like, I'm not hearing her sing. Where is she? And I mean, we were looking all over because she never comes into the guest room. And then they had locked themselves in the bathroom, and they had been like screaming and crying for some period of time. So I was very worried that this was going to be, because I feel like some of my, anxiety around closing the door of the plane is also that I had gotten locked in a bathroom at one point when I was little. And so, of course, I'm just envisioning this, Elle having some claustrophobia and anxiety, for the rest of her life. So you worked with her. And I think in all of it, you realized that it really was way more traumatic for me than it was for her, that she wasn't, having a lot of, but what did we do? We then went in and, showed her how to use the door and sort of tried to reset some positive.
Yeah. And we had her tell us, we did some of that recent traumatic events protocol with her, where we had her tell us as much as she could. And I think we had like the maracas, or we had some things, or like the drums. We had some toys that she was using. Oh, we were playing patty cake as well while she was telling me that. And we used that as a form of the bilateral stimulation. But she's so resilient and strong.
Like nothing ever has come up about that again. Who knows? But, how do you do that? Because I do remember it being a little bit, I don't know if tough's the right word, because, that was at least, that must have been 3 years ago now or something. So she's 7.5. So she was 4.5. I mean, 5 at the most. Maybe it was 2 years ago. So how does one work with children when they're not really, if they are younger and they had some sort of, traumatic event?
Yeah. So we'll try and talk with them first, see how much of the story we can get. And then there's a lot of different things that we can do. We can have them draw pictures of whatever the event was, or the colors of whatever the event was. We really try and get down to their developmental level and incorporate the coloring, the play into the EMDR. So that's what we're able to do. It's really, really effective. The kids are so resilient. They process through things so quickly.
And Is this something like, how widely known is EMDR? I mean, is it something, I doubt this, but, I'm sure it would be great if they were, like, having worked in the ER, we're always unfortunately seeing victims of assault, sexual assault, rape, all of these things. Is that, are they bringing in the clinical therapist? Has EMDR caught on that they know that in these very traumatic events, that's something?
Yeah, no, it's very, very rare if we were to see something like that. A lot of times we'll see alternate practitioners, chiropractors, or we'll see some more of the functional medicine doctors. We'll get referrals from them. They're more aware of it, but I don't think it's as popular as it should be. Even dentists, I think if dentists, and there's so many people that go in there afraid of dentistry work, and I've had so much success. Yeah, I've had so much success with EMDR and the fear of going to a dentist. It would be great if, a lot more physicians knew about it, or nurses, or the healthcare professionals in general.
Okay, I need to see you about the dentist. I mean, I fly to Austin and then I drive an hour to Marble Falls, and I will only see one hygienist in Dr. Nunley's practice because she's so gentle. So I did have a bad experience when I was in Paraguay at the dentist. So that's what did it in for me.
Sure.
Somebody hitting a nerve, and it's just like,
boy.
Yeah. So, and is EMDR something that is typically covered by insurance and on plans, or is it more outside the box?
It just depends. It's more outside the box. However, there are some insurance that are covering some of it. Usually, it's a 50-minute session. However, depending on what the situation is with the client, 50 minutes might not be enough. We might need more, like 3 or 4 hours or 90 minutes, and the insurances don't cover that generally. So, yeah.
And now I know because of my experience, you work out of Tennessee, so you're licensed in Tennessee. You thankfully are licensed in New Mexico, and then you used to live in Arizona, so you're licensed there. So for any listeners that are in any of the other states, is there like a main website or somewhere, is there a broad umbrella organization like we in general have the Institute for Functional Medicine? Is there some a general website people can go on to look for an EMDR practitioner?
Yes. So the EMDRIA website, which is our licensing board or our governing board for EMDR therapists, they have their own website, and you can find a therapist based on your zip code, wherever you're located. So they have a directory on there where you can, access people in your area.
And we know no two people are alike, and even if they've gone through the same training. So, people used to always ask me once I stopped practicing, what are some questions I could ask a functional medicine practitioner to find out, if they really know what they're doing, kind of thing. So are there any questions that you recommend, somebody ask when they're calling to find out about EMDR? Anything that would be a red flag? Just any way for people to suss out,
Right. So the first thing I would have them ask is, are you certified? Because just completing a training really isn't enough, because we're just introducing the basics to a clinician. A lot of clinicians will go out and start practicing right after that training and don't go on for certification. So being certified is really, really, really important. I would ask how long they've been doing it for, and what percentage of their population or their caseload is strictly EMDR. Because what we're seeing a lot of there are lots of clinicians trained in EMDR, but maybe they might see one person a month, where mine's 100% of just doing EMDR. I specialize in that. So if they could find somebody whose primary focus is EMDR, and that is their specialty, that's definitely who they should go with. Because a lot of times, as I said, they might see one, maybe two people now and then and do EMDR, and their skills just can't be kept up if you're just doing it that little. So asking, how much of their practice is just EMDR.
And so you obviously offer, online, but they need to be
Yes.
in one of the states that you are licensed in, correct?
Yes, that's correct. Yeah.
Or, and then you do what are called intensives. They're in Tennessee. So are those individual intensives or is that a group intensive? Or can you tell us about the intensives?
Sure. So the intensives are individual. Everything's private. I have lots of individuals that fly in from all over the world, and they'll come to work with me for like 2 to 3 days. And we'll either do a full day intensive, which is 6 hours a day, or we'll do several half-day intensives. And that's what I'm doing more now, are several half-day intensives, which are 3 hours. And they'll stay for about 3 days, and we'll get a lot of work done in that short period of time. So if you're short on time, or you really need to get healthy quickly, or you need to process through this trauma, let's say you're a mom and you need to start functioning to get your kids up to go to school and do these things, doing weekly sessions isn't enough. You really need an intensive where you can just focus, buckle down, and we can get through a lot of stuff at that time. Yeah. Or people that are just real busy with work.
Yeah. I mean, for me, and this is a different situation, but I can certainly speak to you basically coming to my home and doing an intensive. I think I would have just reached a plateau. I mean, I obviously knew that I needed you to come, because I knew just going in rooms, I was having these, reactions and almost panic attacks in certain rooms of my house, or I had just, spent all this money and time and effort and, everything to build this house. And I hated it. I mean, I hated it. And I wanted to, there were rooms I didn't feel safe in, but then there were rooms I was just angry. I mean, I had problems.
Yeah.
Besides the leak, I had so many problems in this house. I still do, but at least can overlook them now. Okay. And then you occasionally do some women's retreats, and I think you have one coming up next year in 2025 in Costa Rica. So can you tell us about that, and who are those geared towards?
Yes. So they're amazing retreats. I take 4 women a year, and it's an EMDR retreat. So we work on specific traumas that the individual wants to process through. We do 3 to 4 90-minute sessions a day, but I also bring in a yoga practitioner, a Reiki practitioner, massage therapist, a private chef that just uses organic local food to nourish the body. It's really a full body retreat. And it's just been amazing and really successful. So I do have one coming up in March of this year, 2025. I mean, yeah.
Okay. Well, is that where can people find you, and where can they find out more about the retreat?
Yeah. ColumbiaEMDR.com. My website has all the information for the retreat and intensives if they wanted to come to Tennessee and work with me.
Okay, great. Awesome. Well, before we part ways, I always like to ask my guest, what are 3 ways you would recommend our listeners can take back their health?
Sleep, a lot of sleep, good sleep, listening to their bodies, and working on self-care, and EMDR therapy.
All right. I was going to say, if you don't say EMDR therapy at the end of all that, I'm going to say it for you. Well, guys, again, I really like to talk about things that I personally have found extremely successful in my life, and EMDR and particularly Ginger have been those things for me, really got me out of, I could probably cry right now, really got me out of, really the most desperate place I've ever been in my life. So thank you very much, Ginger. And so
welcome.
I can, personally attest to EMDR, with my diagnosis of PTSD, and, highly recommend it, as well as Ginger, if you happen to be somebody who can travel to Tennessee or living in one of the states where she practices. So we'll have all her information below. Are you or your clinic on social media or anything like that, or is everything just on your website?
We're on Facebook, Columbia EMDR, but everything's really on our website, where they'll find most of the information.
Awesome. Well, thank you so much. It was great to catch up, and I appreciate everything that you do for the world.
Oh, thank you so much.
I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.